Hello my people and welcome to my health channel. Today I'm going to talk about typhoid fever. Typhoid is a global public health concern and continues to pose a serious threat challenge in developing countries. It is endemic in countries where there is inadequate sanitation. It's spread by consuming food and water contaminated with stool and urine of an infected person. It's a serious health threat in the developing world. It continues to be a public health concern and is noted to cause 200,000 deaths globally each year. It is rare in developed countries. It continues to pose a serious health challenge in Africa, where there is antibiotic resistance. The reason why it remains a major issue is because of the factors such as increased urbanization, inadequate facilities for processing human waste, the healthcare system is overburdened, overuse of antibiotics, which has led to the development and spread of antibiotic-resistant Salmonella typhi. The disease typhoid has been reported in countries like India, Africa, South Asia, Middle East, Central Africa, Bangladesh, Pakistan, and many other countries. So typhoid is a bacterial infection that spreads through contaminated food and water. It's a life-threatening illness caused by bacterium Salmonella typhi. It's related to the bacteria that causes Salmonella poisoning. It's a fecal oral transmissible disease. It can take up to 1 to 3 weeks after being infected to develop symptoms. It can spread throughout the body and it can cause serious complications and can be fatal. It's highly contagious. An infected person can pass the bacteria out of their body into their poo, which is feces, or into their urine. If someone eats food and water that has been contaminated with a small amount of infected feces or urine, they can become infected with the bacteria and develop symptoms. Some people can become carriers of typhoid and shed the bacteria in their feces for years after they were first infected. There are so many symptoms of typhoid fever. There's cough, there is persistent high temperature, the kind of temperature that gradually increases each day. Then you have the general fatigue, extreme tiredness, general aches and pains, loss of appetite, rash, can develop, dehydration from diarrhea. So please do drink plenty of water and beverage with electrolytes if you are dehydrated. It is important to note that as the infection progresses, you may lose your appetite, feel sick, have tummy ache, and diarrhea. We know that there are cases of people who have developed rash. If your condition has worsened, please go to the hospital where the doctors may give you intravenous hydration through the vein. Okay? Now, what are the treatments for typhoid? The only effective treatment is an antibiotic therapy for typhoid fever. Doctors treat typhoid with antibiotics. In some countries, strains for typhoid have become resistant to most antibiotics. Okay. Complications and side effects of typhoid fever. The main risk of typhoid is not receiving medical treatment. 1 out of 5 people who don't get treatment for typhoid fever die. If the treatment is delayed, it can pose a risk of complications. One is intestinal bleeding, which usually develops in the 3rd week. And when this happens, it can lead to intestinal perforation, where you develop a hole in your intestines and the contents may leak into the stomach and can cause stomach pain and nausea. Then you have the kidney failure, the peritonitis, inflammation of the heart muscle, infection of major blood vessels, inflammation of the pancreas, kidney and bladder infections. Please do seek medical advice if you develop any of these symptoms, especially if you've had typhoid. Okay, now we're going to look at prevention. What do we do to prevent getting typhoid? Wash your hands frequently in hot soapy water before eating or preparing food, as well as after using the toilet. Avoid drinking contaminated water by ensuring water is bottled or boiled. Avoid ordering drinks with ice unless you know the ice is made from boiled or bottled water. Okay, drink safe water, improve sanitation, get adequate medical care, because it can help prevent and control typhoid fever. Unfortunately, this may be difficult to achieve in developing countries. Vaccines may be the best way to control typhoid. A vaccine is recommended if you're going into an area which is endemic from a developed country. Okay, so if you're traveling in, don't take it. Please like my video, subscribe, and share it with your friends. Okay, I hope you've enjoyed it and learned something from this. Thank you for watching. Have a good day. Hello, my people, and welcome to my health channel. Today I'm going to talk about stomach ulcers. Millions suffer from ulcers at some point in their lives, usually people from 60 years of age or over. That is not to say that younger people don't get it. Stomach ulcers are basically open sores in the upper digestive system. If you look on the screen right now, you will see what the open sores look like. So people can have gastric ulcer and peptic ulcer. They occur in the top end of the digestive tract, called duodenum. All gastric ulcers are considered peptic ulcers, but not all peptic ulcers are gastric ulcers. If the ulcer is in the stomach, it's called gastric ulcer. If the ulcer is in the duodenum, it's called duodenal ulcer. Gastric and duodenal ulcers are two kinds of peptic ulcers. Gastric ulcer pain is more before meals, and the duodenal ulcer pain is more after meals. In 2005, two pathologists discovered what is called Helicobacter pylori bacterium, and it's now firmly established that the Helicobacter bacterium causes more than 90% of the duodenal ulcers and 80% of the gastric ulcers. It would be wise to state that not everyone who is infected develops stomach ulcers. While pylori is the main cause of most stomach ulcers, but those who do often experience burning pain anywhere from their navel to their breastbone. People who use non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and people who take aspirin on a long-term basis are at a very high risk of developing painful sores. Continuous or continual use of these medicines can damage the stomach wall, causing ulcers. Alcohol beverages can raise the likelihood of developing ulcers. It's a risk factor in itself, more especially if you have other risk. And if you already have it, it can exacerbate the ulcer symptoms. We know that alcohol will irritate the stomach lining, and when this happens, ulcer can form. Ulcers form because the stomach becomes inflamed, red, raw, and can even bleed. This is the connection between alcohol and ulcers in the stomach. Stress ulcers can cause pain, which may worsen when eating food. It can occur due to physiological stress. Physical stress on the body can trigger stress ulcers. When people are stressed, stomach acid levels can increase, and the lining of the stomach, called mucosa, can be damaged. As the mucosal lining deteriorates, stress ulcer can form. Stomach ulcers or sores form when the acids that help to digest food damage the walls of the stomach or small intestine. And if you have Helicobacter pylori bacterium, it enables this process by attacking the stomach lining, which is meant to protect the stomach from its own gastric juices. Now, once the bacterium has caused significant damage, acid can get through the lining and cause ulcers. Okay, so now I'm going to talk about the symptoms of stomach ulcers. A dull and burning pain in your stomach is the common symptom. You would feel pain between the belly button and the breastbone. This pain comes when the stomach is empty, such as between meals and during the night. You can stop briefly if you eat or take antacids. It can last for minutes or hours. It can come and go for several days, weeks, or months. We also have the less common symptoms such as bloating, burping, feeling sick to your mouth or to your stomach, poor appetite, vomiting, weight loss. Even if your symptoms are mild, you may have ulcer. Without treatment, it can get worse. So if you have mild symptoms, please speak to your doctor about your symptoms. It's very important. Whether ulcer is caused by the bacterium or the use of pain medications, the first step is to reduce the amount of stomach acid in the digestive system. Stomach acid makes ulcers large. The main treatment is to use acid suppressing medications to reduce the amount of acid, and this will surely give reduce the acid in the digestive system. Your doctor would decide which medication to give you. However, medications like omeprazole, lansoprazole, and medications to relieve pain can be prescribed to protect the ulcer while it heals. Those who have a confirmed result of Helicobacter pylori bacterium are given a 2-week course of antibiotics to eliminate the bacteria. Usually, 2 antibiotics are used together to fight infection. In some cases, extreme of course, surgery may be necessary if it doesn't heal. Stomach ulcers tend to reoccur if not treated, so please make sure that you get treatment. Do not ignore speaking to your doctor about this. Lifestyle changes is very important. So if you smoke, quit or reduce your smoking. If you drink, stop completely or reduce your drinking. If you have stress, learn how to manage your stress. Avoid caffeinated drinks, fatty foods, and spicy foods. Okay, if you've listened to what I said about the symptoms and you know and feel you have stomach ulcer, contact your doctor as soon as possible, who can help you to develop a treatment and management plan that is specific to your needs. If you're passing dark, sticky, towel-like stools, you have sudden sharp pain, your tummy gets steadily worse, you vomit blood that appear red, dark brown, rainy appearance, please go and see your doctor. Okay, there could be a sign of internal bleeding. Bleeding at the site of the ulcers, which you will not know or see. Stomach lining at the site of the ulcer can split open. This is what we refer to as perforation. The ulcer can block the movement of food through the digestive system. This is what we call gastric obstruction. Okay, so like I said, the lifestyle changes are very important that you adhere to them. Okay, you could use diet as well to reduce the symptoms. Okay, so I've put together with the kind of food that you have to eat. So if you look on the screen, you'll find what you have to eat and what you don't have to eat. Okay, so that you don't trigger off the symptoms all the time. They come and they're very, very painful, okay, and very uncomfortable. So speak to your doctor if you have any problem. If you have these symptoms, talk to your doctor about it. If you look on the screen now, you'll see the kind of foods that you can eat. Okay, if you look on the screen now, you'll see what the ulcers look like. Okay, please try and keep to a very routine diet. Okay, thank you very much for watching my video. I really do appreciate. Please share the video to your friends. Please subscribe, like, and comment. Thank you so much. Hello my people, and welcome to my health channel. Today I'm going to talk about dengue fever. Dengue fever is one of the most dangerous and fast-spreading mosquito-borne viral diseases in the world. It is a viral illness that occurs in tropical and subtropical areas of the world like Africa, Asia, Caribbean, Indian subcontinent, and occurring totally in more than 120 countries. Dengue is the second most common identified cause of fever. It is due to infection with a virus called dengue virus. It's spread by the bite of an infected mosquito. The mosquito that caused dengue bite during the day, usually in the morning or in the early evening before dusk. These mosquitoes can be recognized by the white stripes in their legs. These mosquitoes are found often near the built-up areas such as wells, tanks, and in old tires. Dengue isn't spread from person to person. Outbreaks of dengue are common and most of the time occur in a seasonal pattern. Outbreaks imported from abroad have been reported in southern Europe. Okay, it takes about 4 to 10 days after the mosquito bites to develop a symptom. Now I'm going to talk about the symptoms of dengue. High temperature or feeling hot or shivering. Look out for warning signs like intense headaches, especially if you are having gnawing or throbbing pains. Person may experience severe headache, pain behind the eyes, joints, and muscle pain. Some have mild dengue fever, which can lead to high fever and flu-like symptoms. Okay, there may be a widespread of red rash, but I need to talk to you about the warning signs. Okay, some have like abdominal pains or tenderness, persistent vomiting, fluid accumulation, liver enlargement. A rash may also develop. You might have a rapid increase in platelet counts or white blood cells. It can damage the bone marrow. Let your doctor know if there is a sign of dehydration or you notice decreased urination. The symptoms normally pass after about 1 week, although you may feel tired and slightly unwell for several weeks afterwards. Now, how do you prevent dengue? There is no vaccine for preventing dengue, but you must prevent it by avoiding being bitten by mosquitoes. There are things that you can do to prevent being bitten. Well, if you use the mosquito repellents, are very good that you use them. If you wear loose but protecting clothing, sometimes these mosquitoes can bite through tight-fitting clothes. If you wear trousers and long-sleeve shirts and socks and shoes, they are very good. Sandals cannot do much. Sleep under mosquito nets, ideally. These nets will have been treated with insecticide. Be aware of your environment. The mosquitoes that spread dengue breed in still water in urban areas. Don't allow water to stagnate in your neighborhood. This advice cannot be complete without saying that you should keep yourself washed and clean at all times, especially if you're walking across waterlogged streets. It's important to know that people who have had dengue before are thought to be most at risk of severe dengue if they become infected again. Severe dengue certainly has signs that can include severe tummy pain, swollen tummy, being sick generally, vomiting blood, bleeding gums, bleeding under the skin, breathing difficulties or fast breathing, cold, clammy skin, weak but fast pulse, drowsiness or loss of consciousness. Severe infections mainly affects the infants and children living in tropics and subtropics. Go to the hospital if you're having any signs or symptoms. Okay, go to your A&E if you're abroad. Okay, now treatment for dengue. There's no cure or specific treatment for dengue. You can only relieve the symptoms until the infection is gone. You can take paracetamol to relieve pain or fever. Don't take aspirin or ibuprofen, as this can cause bleeding in the people. Drink plenty of fluids to prevent dehydration. Get plenty of rest. You really should start to feel better after about 1 week, although it may take longer. Say about a few weeks before you start to feel your normal self once again. If your symptoms don't improve, please seek medical advice. Okay, now I have put up something to show the difference between dengue and malaria. Okay, the differences are not much. Okay, also to prevent dengue, please use repellent. It's very important. Okay, and if you're going to be using mosquito nets, make sure you treat your mosquito net with the repellents. It's very important. Okay, make sure you keep clean, keep calm, and wear mosquito repellents all the time. It's very important. This is one way you can avoid being bitten by mosquito. Okay, now post treatment, and like I said, there's no more treatment. There's no treatment for dengue at all. Just try and prevent mosquito bites. That's one way you can avoid getting a dengue. Okay, if you are traveling abroad, please seek travel advice before you travel into endemic areas. It's very important. Beware of the bites. It's very important. Okay, these bites are caused by mosquitoes. Okay, now you have the symptoms of malaria, symptoms of dengue. Okay, thank you for watching my program. Please share to friends, subscribe, and like my page. Thank you very much, and do have a lovely evening. Hello my people, and welcome to my health channel. Today I want to talk about the dangers of self-medicating in Nigeria. Okay, in case you know, wonder what self-medication means. It simply means say the use of drugs or medicines to treat illness or disorders or symptoms where you self-diagnose. Okay, and income include the continued use of these drugs. Okay, then they define them as the use of medicines by one person, he himself or herself, where they take the treat a real health issue without consulting a doctor. According to who, waiting the World Health Organization, then they define them as the use of drugs, where include herbal and traditional products to treat self-diagnosed disorders or symptoms. Okay, and you continue to use those drugs, they treat your problems, whether now something will come back again or something where they're ongoing, where they continue. Okay, so researchers don't show say self medications don't become a norm in our society, especially in Nigeria. Okay, where they don't see them as a big deal. Self medication they legal for so many other countries, but what happens is that then they get what they call their own over-the-counter medications, and some of the drugs they prescribed by doctors. Okay, but in Nigeria, all una medications be over-the-counter medications, because now money they speak. Now money they buy medications in Nigeria. If you have any money, you go get anything where you want, and I be the danger where they're there. Okay, so the danger where they with over-the-counter medications be say they get them quick. Okay, and them una they develop a reliance on them. Okay, and you una fit reach out to anytime una want, as long as una get discomfort. Okay, but the problem be una dey overlook the correct dosage, and this overlook when they do, they lead to abuse of the drug or addiction. Okay, so the dangers were there for self-prescribing be say it dey mask the signs of a serious condition. So if you get serious condition, it dey mask am. Okay, the condition your health condition can be hidden from the real and actual problem where where they arise from the over-the-counter medication. Okay, some people they get accidental overdose. Okay, when you know they take the right dosage, you take anything where you want. Okay, you know say every drug there within an acceptable range. Okay, and if you go take too much of it, it fit lead to toxicity and can even lead to death. Okay, and we know they remember say not all pain, not all headaches be headaches. Okay, and by the time you go realize wetin dey happen or wetin be the underlying cause, okay, if you don't progress to an advanced stage. Okay, now the thing wey happen be say we need to know say some of the drugs wey people they take can trigger off other problems. Okay, so it may not be good, it may not be a good idea for somebody where they go for surgery to they take aspirin. Okay, because if you take aspirin, it they cause hemorrhage due to its coagulant contents. Okay, we know say some drugs they cause ulcers and neurological disorder with the pack and put for belly. People go buy antibiotics, they take antibiotics anyhow. People go buy flagyl, they take them because they want to get runny tummy. People go they take overdose of paracetamol. They don't know say they cause liver damage. People go they take a lot of these non-steroidal anti-inflammatories like ibuprofen, naproxen. Okay, and tomorrow they go say they get ulcer. They don't know say all these things when they take they cause problems. Okay, drugs get adverse effects. Okay, and it's very important say una know about the side effects. No, they buy medication when no get leaflet, so una go read them on yourself, see what in the dosage be, what in the side effects be. Okay, some drugs when they try, okay, they cause dry mouth, they cause people they know they feel sleep. Okay, I know fit recommend though make people they self-medicate. Okay, because every drug gets side effects, and when I get right to know what in the side effects be. Okay, then when I come rush antibiotics they're dangerous. It is so dangerous. Okay, if it reduce the mass of bacteria if you not take them properly, or when I know the person not there supervised. Antibiotics should only be taken when prescribed. Okay, antibiotics people know say it can strengthen infectious agents rather than subduing them. Okay, and people know they believe say antibiotics get resistance, which is caused by drug misuse. Okay, we know from experience say the people know have a clue say antibiotics they kill the good bacteria in the guts. Okay, and the guts they call them flora. That flora they support immunity. Make una stop the self-medicate. If you're not sure what they talk, stop the pack drug from mouth. It they cause problems, it they cause danger. Okay, now antibiotics where people they take for Niger, they don't know say it they affect the pH levels in the women's vagina. Okay, in they kill protective bacteria, and in they leave our women prone to vaginal infections. Okay, now when people they self-medicate, okay, on things like anti-malarials, analgesics, antibiotics, Okay, they trigger underlying health conditions. Okay, and it fit lead to unavoidable deaths. These deaths, they're frightening, no, especially amongst the poor and the vulnerable. Okay, now these poor and vulnerable people, right, and at them they reside for rural areas. Okay, and it's very hard to reach them. Okay, some medications we know say they interact with other medications. It interact with alcohol, it interact with some foods. And we need to know, say, heavy reliance on these over-the-counter medications where we they lay our hands on. Okay, it is dangerous. Okay, especially the analgesics. Okay, these things they lead to chronic renal failure. Now the pharmacists, the chemists where they for local villages, they know even the help. Now them they even become doctors in the village. They prescribe to to people who are sick, and the people who are sick no even know say they know nothing. Then they see them as lord of the manor, but they don't know say that those people they kill them because they don't even know about drugs. They don't even study pharmacology. They don't even know side effects about drugs. They don't even know what thing they do. They just imagine and give it to them, and then they go take, and then they go trigger off all problems, and they go the wonder who killed them. And then now my people they kill themselves because of the way they self-medicate. Okay, and it did reported sometime in the 80s, say from several studies where they conduct, say that there be an association between chronic kidney failure and the use of other form of analgesics, including paracetamol, aspirin, non-steroidal, anti-inflammatory drugs. Okay, so this is my advice to people, Sha. Make sure so una get leaflet for every packet drug we want to buy. Okay, since you know they get any medical supervision. Okay, and if you get side effects, seek medical attention immediately. Okay, now individuals where they self-medicate may not even know the dosage of the drug, the strength, the composition, the side effects or interaction. Our people need to make sure, say, then they spread the gospel of health awareness, and together all of us fit kill what they call total ignorance. Okay, make them not self-medication, they endanger the heart as well, though. Okay, make I say thank you very much for watching my program. Share with your friends, leave your comments, and please like my page. Thank you. Hello my people, and welcome to my health channel. Canadon Bosso. Today na Schistosomiasis where I want to talk about. When I don't see the name of this disease, it is so long and heavy for mouth. The name be Schistosomiasis. Then they pronounce them Schistosomiasis. It be an infection caused by a parasite worm where people they find for tropical and subtropical regions like Africa, Brazil, Southern China, Southeast Asia, Philippines, Caribbean, Middle East, and many more countries. Okay, this worm where they cause this infection, they live in rivers, lakes, and streams. Okay, this worm they live in these waters. Una know that our water they cloudy where people they go, where they red. Okay, where toads they fall into. Hey, that water na poison. Plenty disease they inside that water. Now information I bring to una so that make una dey careful. Make una know that they get diseases where my people they get from our local waters. Okay, water where get so much parasites where they live in freshwater snails. Although the parasitic worms no dey for Europe or USA waters, okay, and no dey for many developed country water. People they get infected worldwide. More than 200 million people don't dey infected. For Africa, the water I dey hammer on here, now that water or river where una they see church people they take people go say then they wash them for healing, comot demons from them body, baptize them. That same water juju people they use and for sacrifice. These same juju people and church people go kill fowl and goat, cut their head, pour their blood into the water, and throw either the live goat or dead goat into that same river. Chai, this one na killer. Okay. So all the story then they tell una say na healing una dey go to for this river, na baptism una dey go for, or they carry una go there for sacrifice because they wan remove evil from una body. This water dey polluted with orishirishi and with the worms wey dey cause more serious problems. This water dey cause serious wahala for people in years to come. Make una eye open and make una hear now na wetin wey go help una and save una all. Okay, when this worm enter body, na death sen ten ce e be o. Okay, no be this same water people dey enter go swim, children dey enter go swim, people dey paddle on this same water. Yeah, some even dey drink am, some even dey take am wash dem body. Okay, na this same water people dey carry go home go drink, some dey use am to cook food. Na this same water get these snails wey dey live in am. These worms dey live in the blood of vessels wey dey around the bladder and bowel when the worm don enter the body, and people no they go dey go there go do washing. How people dey get this infection? The worms wey dey cause this schistosomiasis dey live in these rivers, lakes and streams. Okay, and people fit get them from reservoirs and canals in tropical and subtropical regions. Okay, now I wan talk say showers wey dey take unfiltered water directly from the lakes and rivers may also spread the infection. Okay, but the worms are not found in the sea. They no dey find these worms where chlorinated water dey, like those swimming pools. Okay, or water where they don't treat properly. Okay, now somebody fit dey infected if they come in contact with the contaminated water. For example, if you dey paddle, if you dey swim, if you dey wash. Okay, these worms dey burrow into the skin, and once e enter your body, the worms go move through your blood to areas such as the liver and bowel. And once e dey for your body, after a few weeks, the worms go start to lay eggs. Some eggs remain inside the body and are attacked by the immune system. Okay, or then they attack the immune system, while some are passed out in the form of poo and pee. Without treatment, these worms fit dey there, they lay eggs for several years, and if the eggs pass out of the body through poo or wee, they release tiny larvae that need to grow inside freshwater snails for a few weeks before they are able to infect any person. This means that it's not possible to catch this infection from someone who they infected. Okay, now many people with this long word schistosomiasis know they get symptoms or even experience anything for several years or even months. Okay, and you probably not go even notice say you dey infected, although occasionally people they get small itchy red bumps on their skin for a few days. Okay, where the worms don't take enter, as you see in that leg where they're there. Now after a few weeks, some people feel develop high temperature where go there like over 38. Some people go get itchy red blotchy and raised patch. You see picture where they enter. Okay, some people they cough, some people they get diarrhea, some people they get abdominal tummy pain, some people they get sense of feeling really unwell, some people they get aches and pains. Okay, these symptoms they usually get better by themselves within a few weeks, but it is important to get treated because the parasite can remain in your body and lead to long-term complications. See water where they go fetch, go drink, go swim, even cow they inside the water. Okay, now long-term problems where they're caused by this disease, or even people they go there. Okay, some people with this schistosomiasis, whether they don't get initial symptoms or not, may eventually get serious problems in parts of their body where the eggs don't travel to. One part of the body be the digestive system. If it cause anemia, abdominal pain, and swelling, diarrhea, and blood in your poo. Okay, now if it enter the urinary system and cause irritation of the bladder. Okay, when you pee, a frequent need to pee, and blood in your pee as well. Now, if it enter the heart and lungs can cause persistent coughing, wheezing, shortness of breath, coughing up blood. If it enter the nervous system or the brain and if it cause seizure, which be epilepsy, headaches, weakness, numbness in your legs, and dizziness. Without treatment, these organs can become permanently damaged though. Okay, so the way to prevent them is to there's no vaccine where they prevent them. Okay, so it's very important that you be aware of the risk and take precautions to avoid being exposed to this contaminated water. If you visit Africa, Asia, South America, Middle East, and many other countries, please make you aware that these parasites stay in their waters. Make you avoid paddling, swimming, and washing in fresh water. Boil your water, filter your water before you go drink them. Avoid medicines where they sell locally because they may be fake, substandard, ineffective, and not giving correct dosage. If you went to school back home and you say you go swim or you drink those water, you go watch for those local rivers and streams, you need to get a test if it live in your body for years to come. Okay, now if you get any problem, make you seek medical advice. Okay, go to the hospital if you develop symptoms where I don't mention about. And if you don't travel to all those parts of the world where get the parasite in their water, please make you tell your doctor about them. Make you keep quiet if you begin to get symptoms. Okay, see picture how they enter leg. Okay, say you don't see it get fucked head, so when you enter you go even know because it's inside the water there. Okay, if you think say you've been exposed to this water, you need to tell your doctor about it. Okay, if you're there abroad, go home, go use this water, come back, or go expose. You see them then they go pray for water. See what they do for water. Now all this is the cause our problems because people don't know say these things there for water. Okay, especially people where they live abroad, they will go say that they go for prayers, then they go do something for water, and juju people go carry them go do sacrifice for place where you go enter, put your leg in, you don't know what enter your body, and you don't know how what it go cause. See people there where they go inside those kind of water, say then they go do prayers. Anyway, make I continue, Sha. Okay, if you don't travel to those kind of countries where get these things, you need to come back tell your doctors. So you bomb my way calling with your wife. So please make sure say you take precautions. You know the symptoms, you speak to your doctor about it. If you get any of the symptoms, speak to your doctor about it. Make keep quiet. No matter, no shame. Just make sure say you're doctor. They go do tests, they go find out whether you get them. Okay, now I want to say thank you for watching my video. Make you share my video to your friends, and please like and subscribe. Okay, thank you so much. Hello my people, welcome to my health channel. Today I want to talk about lemon juice, why it's so good to take it every day, and the benefits. To prepare lemon drink, you must have lemon juice and water, okay, at home. Lemons have citric acid than any other fruit, so it's important to dilute lemon with water of any temperature, though lukewarm water is recommended. Best time to take it is first thing in the morning to jumpstart the system for the day. So my people, for the purpose of this video, I go link lemon to blood pressure, even though we know say lemon gets so many other uses. Today I will talk about using lemon drink to lower blood pressure. One of the major health problems facing the world today is blood pressure. Blood pressure they refer to as the silent killer because people they walk around with no pre-warning symptoms. Nothing they happen to them. They just they waka and they feel right. Okay, so from my work experience, I find it very dangerous because somebody will come in, they feel good, they do everything, but when you check your blood pressure, they hit the roof. So it is very, very difficult, and it's just a killer. Okay, blood pressure is a chronic disease. Chronic means it's an ongoing problem once diagnosed. Okay, so lemon gets very powerful blood pressure lowering effects. Okay, lemon they packed with several minerals and nutrients, which include vitamin C, B complex, vitamins, calcium, iron, magnesium, potassium, and fiber. All this helps to build or to keep your heart healthy by reducing heart disease risk factors like blood pressure. Lemon they rich in vitamin C. According to Yogi Kato, recent studies suggest that the daily intake of lemon gets a very good effect on health. Lemon also contains vitamin C, where they remove free radicals, which are known to cause a person's blood pressure to rise. In my last video on blood pressure, I explained that blood pressure is the force that is exerted against the walls of the blood vessels. Research shows that fresh lemon drink makes the blood vessels soft and flexible, reduces blood pressure, and aids the blood to flow through. It's said that lemon drink is perfect for clearing blockages in the blood vessels. So if BP is reduced, it lowers the risk of stroke. Another study in the Journal of Internal Medicine, published in 2010, states that lemon contains folic acid, which has been found to potentially offer a modest level of protection against stroke. Okay, so lemon is very beneficial. Please don't stop taking your medication. Please do not start drinking lemon alone. Do not try this without seeking advice from your doctor. If you have any health problems such as gastro problems, please speak to your doctor. If you have any other underlying health issues, consult your doctor. This is my safety net here. Thank you for watching my video. Please subscribe, like, and comment on my page. Thank you. Bye-bye and have a good day. Hello and welcome to my channel. Today I will talk about routine blood tests. Routine blood tests be blood tests where they important that everybody they take them from time to time. They get other blood tests as well where doctor fit add on to request blood tests. Say like if somebody goes see doctor and they know well and doctor won't look out for something or won't check something or won't make sure say that they make the right diagnosis, him fit request for blood tests, and if it add on the request blood test, or he may add some part of it to whatever test he won't do. Okay, so is it okay for the patient to take the initiative, ask for routine blood tests as well, so that everything can be done in one go. Okay, so if you ask the doctor, I don't see any reason why he go say no, he no go do them for you. Okay, especially if you're an adult. Okay, so make the initiative and ask. Okay, routine blood tests, they're important with or without any illness. Okay, so even if you don't get anything, still request for it. You don't have to wait for you to get ill before you do it. Our body, they like engine, so this body needs to be fueled. Okay, this body needs to be oiled, just like the oil engine, the fuel engine, to make sure the car they on the road. Make sure you do tests, look after your body so that you can live longer. Okay, so for people where they take medication, it's very important for them to they do blood tests, and these blood tests they within the routine blood test as well. Okay, to do this blood test, they important because you go know what's in the happen inside you, and you go know about your overall well-being. Okay, and this blood test will help you as well to make an informed decision about your body and lifestyle. So I'm going to be talking about the blood tests where they're important that you do, and routine blood tests be a name, but it gets so many blood tests within it. Okay, so I go start with the first one, kidney function. Okay, now kidney function tests, they measure the level of waste products. Then they call creatinine, where they're for the blood. Kidneys, okay, they clean the blood, they remove toxins, and they transform them to waste, and they come out in form of urine. That is when you say you dey wee. Yeah. Now kidneys, they remove all the medications where they for our body. If they balance the water where they for our body, if they release hormones, and if they regulate blood pressure. Okay. Kidneys also, they produce an active form of vitamin D where they promote strong bones. Okay. Now, if you look on my screen, you will see the symptoms and signs of kidney problems. Okay. So if you get any of those things, please go to the doctor. Okay. I beg, no wait, just go. Now blood test they go do, and they go find out what's there wrong with you. At least if you don't get anything, it's good. If you get something, at least you can get early treatment and not wait for it to get worse before they go detect them. So kidney function tests, they're very important that everybody they do them. Okay. Now within this kidney function tests, they get within that they call urea and electrolytes. Okay. These be minerals where they inside the body. Okay. Now, the urea and electrolytes be minerals where they're inside the body. Okay, you dey hear about sodium, you dey hear about potassium, magnesium, chloride, and you dey hear about zinc, okay, and many others, okay. If they help to maintain water where they're inside our body, if they get any changes to the level of electrolytes, if it cause various causes, okay, like dehydration, diabetes. Okay, so the next one where I go talk about now be the liver function test. All the blood where they come out for our belly and intestines, they pass through the liver. The liver, they process blood, they break them down. Okay, they balance and create nutrients. This same liver, they metabolize all the medication where we they take okay? And they make them easier, okay, for it to come off from our body, okay? So liver basically they filter, they digest, they metabolize, they detoxify, okay? Basically, liver they clean the blood, okay? We no fit live without liver, okay? But we dey possible that we go live with part of the liver. So if the liver spoil or e damage, yeah, it go release a substance called enzymes in the blood. Okay, they make the levels of protein produced by the liver to drop. So it's important that they measure the levels of enzymes and proteins, okay? Otherwise, it can lead to diagnosis of liver conditions such as hepatitis, cirrhosis of the liver scarring, okay? And alcohol-related diseases. So it's very important that, we check them all the time, okay? We take medication. So the person when they take medication for a long time needs to do liver tests. It's very important, okay? So people when they diagnose themselves, they self-medicate. Don't forget to take your liver test, especially if doctor know they monitor you and you've taken it for a very long time. So my next test is the lipid profile test, okay? When they hear about cholesterol, when they hear things like, say, cholesterol dey high, e dey low, e dey this, e dey that, okay? And if they get high cholesterol, if it cause an increased risk of problems like heart attack and stroke, okay? Now, they get good cholesterol and bad cholesterol. The good cholesterol be the HDL, where they remove harmful substances, and it help the liver to break down these things into waste. Now, the bad cholesterol, which they call LDL, they cause plaque, where they develop in arteries, increasing risk of heart disease. Okay, so it is very important that we do all these things tests. We not overlook them. Okay, now the next test I want to talk about here, where they're very important, is the thyroid test. Okay, thyroid test. Thyroid there for neck. Okay, so if they produce and they react to certain hormones. Okay, thyroid be a gland where there for our neck. Okay, so it help regulate the body functions. Make our body they function well. Okay, sometimes we find ourselves, I say, we get different moods. It affect our moods, it affect our energy and overall metabolism. Okay, if thyroid they abnormal, yeah, if it indicate conditions where they're like low protein levels, thyroid growth disorder, okay, then you'll get abnormal levels of hormones like the testosterone and the estrogen. Now, the next test what I want to talk about is sugar level. Then they call them blood glucose. Okay, blood glucose test be what they call sugar, what they for blood. Okay, and then they take them they diagnose diabetes. Okay, then they take them, they monitor people who get diabetes, and then they take them, they diagnose diabetes. So if somebody glucose they high, doctor fit tell them, say, make they go do the glucose tolerance test. Okay, that test, now 2 tests in one go. So you go do the first one, you go fast go, do the first one, then they go give you a sugar drink to take, and then they go bring you back, do another blood test again. So when they do that one, if they're high, then they go do the HbA1c. They all come under sugar test, okay? Now that HbA1c, then they take to diagnose diabetes for everybody, okay? So the HbA1c, they cover your sugar level for the last 3 months. So that one, they give them accurate picture of what they happen, and then they will diagnose you. Okay, so it is important, say, you watch what you eat, you do your blood test regularly, you monitor yourself as well. So the next one I want to talk about now will be the full blood count test. Okay, now the full blood count be a hematology test where they assess blood counts, okay, and they look out for abnormalities that might indicate a problem. Okay, now this full blood test fits and they assess the white blood cells and the red blood cells. Okay, and they include looking at an indication of inflammation. Okay, and then you will look at that inflammation indication where they look at they call them erythrocyte ESR rate. Okay, now this full blood count where we all talk about, okay, they're very, very important because they provide clues about certain health problems you may have. Okay, This test is used to detect a wide range of disorders like anemia, infection, blood disorder, leukemia, especially if you're having symptoms of fatigue, weakness, inflammation, bruising, and bleeding. So it is very important that somebody do this test. Very, very important too. Okay, so the next test where I go want to mention here as well is the nutritional deficiencies of B12 and B6. Okay, so they get symptoms, you don't on the screen now: dizziness, depression, and many others. Okay, high temperature, mood changes. If you get any of these symptoms ready for screen, please make sure you do all these blood tests so that if there's any deficiency, they will give you supplements. Okay, for abroad, and they know they waste time. Once they find them, they will give you supplements immediately, and they go boost them. Okay, like B12, they come in form of injections and tablets. So either one way go work out, it will give you. Okay, supplements there for shops. So if you know, say you get deficiency, doctor will tell you which one you go buy, and then you use it, because it's very important that you get on it. Okay, there are other vitamins as well. So look out for the one where they low, and then make sure say you take supplement for it. It's very, very important. It's part of the routine blood test. Okay, so what I go talk now be say I won't repeat again. It's because we know say our body, they important that we look after them. Okay, make we always do that. Okay, our kidneys, our liver, they're very important. They are organs in our body. They're very important. Recommended routine blood tests, they're very important. Do it every year, once a year, twice a year. No keep quiet, no overlook them. No take your money, they do so many other things, but they look after yourself. Tomorrow, if anything happen, they go look at other things, and that thing they do them. When now because we no look after ourselves. Okay, it's very, very important. I don't think say anybody go say make you do blood test. For Africa, you can walk into a lab and do the blood test. Thank you for watching my channel. See you. Welcome to my channel. Today I got my blood tests. I got my reason didn't name blood tests. Nambido ya ụfọdụ ndị na-enwe opportunity eme ha blood test. Mana onwe ndị na-anara ya ọya mana fejin be blood test. So amaro ife na-eme. So ọ dị mkpa na onye ọbụla je test at least once or twice a year. Okay, as we get older. Okay, ọ na-enyere anyị aka ịma ma nwee nsogbu dị ka anyị nwee take a precaution, and ọ na-enyere anyị aka to make a decision about our life and lifestyle. Ọ dị mkpa na je blood test because na I wear motor, I need to make sure na motor I akụrụ engine, so I need to make sure na I need for service. Man, I realize with that initiative, sick I my blood test, kaya mokwa na ime system I or them ima raya na rafu so I need my blood test. Kaya sure na I do okay. All the important, okay? So it's why he is seeing motor priority, making sure na motor akụrụ engine, nya rogo priority as well. Makoge help anya bio ogono. Okay, around well so many organs. Okay, and I need to make sure na I name a blood test. Can we make a reduce risk of diseases? Okay, risk of all your DHH. Okay, blood test they make sure na ni open I went oya. It will tell you no gay. Open I can wet oya. I am an ideal came up and when science and aptano. Blood results on with changes. Kawe marker is monitor. Organs na around urine, but get mention about liver, thyroid, na kidneys. Okay, I need a lab regularly. Okay, organ keep prevent umoya nina. Can we get pitaka? Or the man I check oblani makana on a to improve our mood, brain function, and energy levels. So all the number I get blood test governor. Now I'm got sex hormones. Okay, sex hormones they banana. I'm a test about it. Test hormones include testosterone, estrogen, and estradiol, and many other ones. These hormones na cause low moods, more any deficiency of it. On a cause umwoke asina family kid na unyefa. ụmụnwaanyị asị na afa nwere problem with their periods ọ nara abịa or stop fa nwere ike ịdị ime ha mara mgbe ha nwe ovulation, so many things, ma ha na-bleed heavily. So ọ dị mkpa na ụmụnwaanyị mee test a niile. Ụmụnwaanyị nwoke asị na afa nwerozi interest na sexual activity. Okay, reasons niile bụ because na ha enwere drop in their sex hormones. Okay, so a blood test nwere ike idetect ya. Ọ bụrụ na o nwere ike idetect no, a blood test na-edetect ya amala ife dị wrong. Okay, m ga-akpa maka mara akọwanwu maka liver na kidneys kịta maka na mmemme another video about it ebe m agwụrụ maka blood test a na-akpọ routine blood test, gwazie unu test a na-eme and why I need ime all those tests. So today m ga-akpakwa maka na imi ọbara na-enye aka pick up infection dị n'arụ mmadụ. Okay, so nwere blood test a na-akpọ full blood count. Ọ bụ na the white blood cells ga-agwa anyị ma enwe infection, the platelet count ga-agwa anyị ma enwe any problem with the clotting. Okay, ka anyị mee these things ka anyị ike maximize our healthy lifestyle. Ọ dị mkpa na anyị mere ife niile. Okay, now mma akpa maka weight. Ndị mmadụ na-put on weight and ndị mmadụ na-lose weight, and ha nwere ike ịmara reason iji put on the weight, ịmara reason iji lose weight. So ọ dị mkpa na onye na-put on weight ga-eje blood test ka amalụ ma o nwere any problem, because he put on weight may lead to heart problems, liver damage. Okay, and ọ bụrụ na ị na-lose weight as well, ọ dị mma na ijekwu test, because on a lose weight we can lead to things like thyroid problems, onwe kopụna onye nwe cancer, onwe kopụna onye nwe diabetes, onwe so many others na-eme mmadụ lose weight. So blood test bụ ife ga detect ma all those things obidogo. Okay, diabetes bụ something na-eme ndị mmadụ now. Anyị niile ndị ụwa niile ma na diabetes abịagoro nne. So ndị mmadụ need na-eje blood test ahead of time ka dị sure na fe nwere ya ana ha marọ. So ọ bụ na-eme blood test afọ eme ike detect ya ma na ha nwere ya ka we bido treatment n'oge, because ọ bụ na-eme treatment o nwere ike damage kidneys. Okay, so ọ bụ na mmadụ kaba nka ọ na-abụ a risk factor. Okay, oge ọbụla ife ọbụla ga wrong asị ka anyị ama ife na cause ife afọ. So ọ dị mma ọ bụ na eji ga agbakọta biko try ka ị na-eje blood test afọ alịsa onwe ihe mee ka ị treat nwa ogo gwa ka ife ị ga-eme. O nwere ọya ndị ọzọ na-abụ ọya ndị mmadụ na-eme inherit from the family like sickle cell. Okay, enwekwala arthritis, diabetes bụ one of them, stroke bụ one of them, Alzheimer's bụ one of them, heart problem bụ one of them, blood pressure bụ one of them, multiple sclerosis, cancer, thyroid bụ ife na family. So ọ dị mma from time to time check ya ka sure na ike enwetara ya, ọ bụ na enweta ya ka enwe ike manage nwe ya n'oge. Okay, doctor na-enye ndị mmadụ ọgwụ chọọ ịma ma ọgwụ na work. Okay, so doctor na-etinye mmadụ n'ọgwụ chọọ itinye mmadụ n'ọgwụ ga-echeki ka ọma na ọgwụ na work. For instance like diabetes, ọ bụ na etinye n'ọgwụ diabetes any dị mma ma ọgwụ afọ na-bring sugar down ka everything on the worst, any dị mma maka your diet, any dị mma na enwere things na change, more changes on other organs na dey affected and everything. All through blood test ha ka na-esi ama ife niile. Okay, and ọ bụ na na-enye gị ọgwụ doctor nwee ike ma na etinye ọgwụ ọzọ, wepụ ọgwụ, change ọgwụ. Okay, coalition na ka nwere ike adjust your medication and treatment. Ọ dị very important na eme blood test ka dị sure na everything dị okay. A na-ejikwa blood test check for nutrients dị n'arụ anyị. Okay, and nutrients bụ ihe na-eme sure na I remain healthy and smooth functioning. Any deficiencies can cause or lead to things like fatigue, ike ịgwụ mmadụ, headaches, ihe alarụ ụla, inwe body odor, inwe muscle cramps and constipation. This blood test may look at minerals. Okay, they sure that not everything is okay. On a blood test they look at like B12, potassium, calcium, vitamin D, zinc. Okay, so not only looking at nutrients like B12, iron and ife niile ọ na-look at potassium, calcium, condition na your electrolytes dị okay. Ọ dị very important na echekili ife niile oge ọbụla. Okay, asa na asị na health bụ wealth. Ọ eziokwu, arụ dị anyị nwee ike dị happy, nwa aṅụle. Okay, ọ bụrụ na anyị amara ife na-eme anyị dị so uncomfortable, arụ na-agbakasị anyị mana anyị amara na something na-eme anyị already. Mana ọ bụrụ na anyị na-eje regular blood test, then ọ bụrụ na enwe ihe pụta anụ enwe ike deal with it. Okay, lotekwa na ọ bụrụ na ndị nwe arụ ya anwụgo like cold and fever, cough and headaches. Okay, eme physical examination nwere ife anyị afụ, mana ọ bụrụ na eme blood test o nwere ike amount the exact status of that person. Okay, achọrọ m ịkọwa na arụ anyị dịkwa ka engine. Biko onye ọbụla lote na 10 years ịgba moto na-emebi moto, 10 years ịnya a car ihe ama na 40 ga-adị after 10 years. Okay, onye kpata eji eje test, onye kpata eji eme service ka make sure na everything na-aga ọfụma. So as an adult, make sure na ị na-aga for blood test. Take the initiative, go for doctor. Okay, ọ bụrụ na ị nọ na country ebe ị nwere ike ije eme lab test, next video m ga-agwa gị the lab test ị need ime ka emeke sure na ịdị okay. Kama na arụ mgbazikwa gị, biko jefu doctor maka na enwere more blood test enwekasị enwere ike add ka wee makwalụ ife na-emenụ. Onye kpata ha bụ ibefu doctor jụọ ọgụ kedu mgbe o bido, kedu ka o si eme gị, na kedu symptoms ị na-enwe, ka o nwere ike manụ nwee other blood test ọ ya add ka o nwere ike nwee mee diagnosis. So ọ dị mkpa na onye ọbụla je this blood test. Biko nụ ka anyị eri jie were ife mee ife egwuregwu. Ụfọdụ ndị amara na ife a dị mkpa na anyị na-eme onye akpata nji wee pụta sị ka mba ka nkọwara ndị be anyị na ife a dị mkpa. Okay, na anyị need blood test a niile ka anyị malụ ka arụ anyị si aga. Okay, ọ bara ụlọ ịpụta iburu niile lie nọdụ dị happy na-aga n'ụwa mana isi ọzọ ka icheki arụgụ, mana ọ bụrụ moto gị gbago cheki gbo moto o make no sense. Onye akpata gị sị mba mpụta ka nkọwa ndị mmadụ ife niile aka ha ghọta. Okay, onwe ihe chọrọ ịjụ m biko jụọ m. Okay, tata gbugbo blood test dị mkpa. Thank you for watching. Thank you for listening to me as well. Look out for my next video where I will discuss about routine blood tests. Please comment and subscribe to my channel. See you soon. Thank you very much and look after yourself. Okay, biko ijena una jina deba worried mana oyema na iye take with the initiative je draw for blood test. Okay, ọ dị mma na akọwalụ gị ya kama ya nọdụ ife emebie jee mee test a kedu sure na nwere ife na-emenụ. Okay, arụ mmazi ahụ biko jefu doctor. Okay, etekwana law into your hands, jefu doctor ma nwe ife na-eme gị ma doctor nwere ike add more blood test. Okay, daalụnụ. Okay, and thank you for watching. Bye.